Hello people, in this video we are looking at an emergency case discussion. You're posted in the mountain now. Okay, this is a mountain. These are trekkers who are climbing this peak. Now here is the question. You're working on an expedition on Mont Blanc. So this is one of those mountains in Western Europe, and are asked to see a patient who at 3,500 meters has developed wet cough with frothy sputum from his mouth. He has wet cough. Okay, that means it's not dry cough. He has production, expectoration, and how is the expectoration? Frothy sputum, air mixed. Okay, the patient is tachycardic with high respiratory rate. He's breathing fast. You hear bibasal crepitations in both the lungs. So both the lungs, what has happened? You're hearing basal creps by both of them. I'm thinking bibasal means bibasal crepitations in both the lungs. Now when you hear this and the patient has been brought in, what is the patient saying? The patient insists that they have mild mountain sickness. Earlier also they have had all this mild acute mountain sickness. No problem. I will continue. He wants to continue to summit. Summit is what? The peak of that mountain. And they have not taken any prophylactic medication. So what is the appropriate plan? Okay. You're the emergency doctor here. So your options are A, B, C, D, E. Okay, so now you can see this. A. Option A, patient has high altitude pulmonary edema, should descend to this by at least 1,000 meters. He should descend. That means if he's at 3,000 something, he should go to 2,000 something, and he should, along with that, he should be given high flow oxygen. Okay, he should not simply descend, he should be given high flow oxygen. I think alongside that he will descend. The patient is most likely correct. Oh, the patient itself is correct, this thing, and he has mild acute mountain sickness and should be allowed to go. Would you do this? They didn't talk about oxygen saturation, etc. here. So the patient is mostly likely correct. Would you want to choose this? It's coming to C. The patient has high altitude cerebral edema and should be given mix and then shorter descent. Now why cerebral edema they brought in here when he has no signs of any neurological thing? The patient has no evidence of high altitude illness. The findings are consistent with normal physiological changes at altitude. No action is required. Wow. Coming to E, the patient has severe acute mountain sickness and should remain at their current altitude for 2 to 3 days. Will he remain at current altitude with severe acute mountain sickness? I don't feel that's right. What do you think the answer is, people? You had a thought? Okay, so will you say the patient is right? If you say the patient is most likely correct, then you can say that this patient has no evidence of this altitude sickness. Both of this will become true, right? So I will say this no action is required. All this seems wrong. Then he has cerebral edema. This I don't like. Now A or B should be correct. Giving high flow oxygen sounds about right to me. So I would like this A to be the answer. What do you think is the answer, people? So the answer is A. So the patient has what? High altitude pulmonary edema. That's why you're hearing those creps, etc. Bibasal creps. So bibasal crepitations. He has high respiratory rate, frothy sputum, wet cough, tachycardia. He's at 3,500 meter. You should take him down to 2,500 meter with high flow oxygen. That is the treatment that you will suggest. Okay. This is HAPE, high altitude pulmonary edema. HAPE. Okay, this is a life-threatening condition and it will occur within the first 4 days after an ascent above 2,500 meter. It is a leading cause of mortality from high altitude sickness. Okay, so HAPE. What is HAPE? High altitude pulmonary edema. Very good. So it is life-threatening. Okay, leading cause of mortality in high altitude illness. Initially they'll have dry cough and all that, but once it has come to this wet cough, no, it is actually the next stage part of it. Okay, so wet cough means he's almost in the next one already. See, initially it will become dry cough, later it becomes wet cough. Okay, and this tachycardia can be at rest also, right? He has tachypnea also, right? You should understand. Then this crepitations in both lung fields. So all this is the next part of it. Fever may also be present. Hypoxemia will be there, which they have not mentioned here with the SpO2. So when you do a X-ray, you can see diffuse alveolar edema. So the edema they are talking about is in the alveoli, not in the brain as of now. Okay. So what about this acute mountain sickness that they are talking about in these options? Here there is an option here, E, acute mountain sickness. So AMS, what is acute mountain sickness then? See, here they are talking about entire body kind of a thing. They're not talking only about pulmonary, right? So here they're talking about nausea, vomiting, loss of appetite, malaise, etc. So when you saw high altitude pulmonary edema, HAPE, they were talking only about the lungs. Okay. Acute mountain sickness, they're talking about nausea, vomiting, a lot of other things. So what is the treatment? High flow oxygen, immediate descent by 1000 meter. Okay. You should target oxygen saturation to be greater than 90%. Okay. You will have a portable hyperbaric chamber. If you cannot descend the person, then you should have hyperbaric oxygen. Remember, just high flow oxygen, no. If you cannot descend the person, then you should have portable hyperbaric chamber. Okay. If descent is delayed, then you should have hyperbaric oxygen. We already told you. Prophylactically, you can give Nifedipine to reduce pulmonary arterial pressure. Okay, what will you give? Nifedipine. DIPINE. Okay, to reduce pulmonary arterial pressure. Pulmonary arterial pressure. To reduce it, you will give Nifedipine. Okay. So this they should give, what they are saying is this should be given prophylactically. So before he can again ascend, right? Then continuously for 5 days again they are giving. Okay, guys, did you understand? 1 day preceding ascent they should give this and continued for further 5 days. So they are talking about Nifedipine 60 mg, okay, divided into 2 to 3 doses. That is prophylaxis. Okay. So that is the prophylaxis that you will give before allowing him to ascend. Okay. I'm thinking for all these people they can give that before they have these symptoms itself. That's why in this case they have mentioned that they have not taken prophylactic medication. Okay. That's what they have mentioned here. So this is a case of HAPE, high altitude pulmonary edema, which you have seen in this video.